The greatest impact from President Trump's tax and spending bill will be on the Medicaid program, which will lose $1 trillion over the next decade.
Tonight, for the first time, we're going to hear from the head of the state agency that administers Medicaid here in our state. Your political reporter, Sean Boyd, sat down for an interview regarding the future of a program that provides health insurance to 1 in 5 Coloradans.
To set up an entire industry in 18 months.
As executive director of the Colorado Department of Healthcare Policy and Financing, Kim Bimsteffer oversees the state's largest health insurance program. Medicaid covers 1.2 million Coloradans. That's 1 in 5 residents. Verifying the eligibility of so many people each year is already a colossal task. Under President Trump's new tax and spending law, it will become far more challenging. The state has sophisticated software that can automatically check things like age, income, address, and citizenship. But the new law creates new requirements, including 80 hours of work, school, or community service each month for people between 19 and 64 who aren't pregnant, disabled, or have kids under age 14. There is no automated system for that, no master list of who's volunteering, for example, to verify eligibility. And the state now has to do that verification twice a year.
But we have to build the entirety of the infrastructure to capture and automate and make sure that we don't have people impeded of getting through the eligibility process and therefore losing coverage, because the downstreaming impacts of people losing coverage are absolutely catastrophic.
But Bimsteffer worries thousands of Coloradans will lose coverage.
They'll move, they'll change their email address, they won't realize they have to do it.
Leading to more uninsured patients and more uncompensated care, which she says will increase costs for everyone.
The North Star is to have people covered, but again, this is going to be part of many difficult decisions that the state is going to have to step up and make.
The new eligibility requirements kick in the end of next year. While the law provides $200 million total to help with implementation, the state of Kentucky spent $270 million alone on a work-only requirement before a court blocked it. Bimsteffer says not only will Colorado have to spend millions of dollars on new hires and new systems to implement the law, it will have to do so as it loses millions of dollars. Starting in 2027, the law limits federal matching funds that Colorado has used to increase provider reimbursements. Bimsteffer says the state could lose up to $2.5 billion.
Are we going to lower provider reimbursements? Are we going to change benefits? All those are very difficult decisions, but we're going to have to move some of those levers in order to deal with the fiscal realities that the costs will continue to go up and the revenues available will continue to be strained.
Sean joins us now, and there's obviously a lot to discuss with this. When will the state have to start making those cuts?
Well, most of those changes in the law don't take effect for at least a year and a half. Bimsteffer says she really needs to start preparing now, which takes money. So lawmakers who decide what services are covered are going to have to make some tough decisions soon. Governor Polis is expected to call them back to work next month.
We also know the original bill included a provision that cut federal funding to states like Colorado that pay for health care for undocumented immigrants. Was that in this final bill?
No, that was not. But that doesn't mean that the program won't face cuts. When it was started or passed, the law was passed in 2022, it's expected to serve 3,600 people at a cost of about $27 million this year. It serves nearly 6 times that, 21,000 at a cost of more than $50 million.
How many people are going to be impacted by these new work requirements?
Up to 377,000 Coloradans. It's estimated right now about 56% of them are already working. It's verifying that's going to be the challenge.
Yeah, you also mentioned Colorado could lose up to $2.5 billion. Yeah. Can the state come up with that money? What are they going to do?
No, the state budget is already looking at a $1 billion hit from other provisions in this law. The money was used to increase provider reimbursements. So if that drops, the fear is that providers may not take as many Medicaid patients. The good news is the law does provide $50 billion for rural hospitals. They see the largest number of Medicaid patients. And that money should be dispersed within the next few months. It's unclear how much of it Colorado will receive.
A lot to break down tonight, Sean. We appreciate you joining us.
You bet.
Thank you, Sean.